Well, China has reported nearly 13,000 COVID-19 deaths in the past week, but the number only includes deaths in hospitals. Now, the country has seen a huge surge in infections since abandoning its zero COVID policy last month. The official death toll is now more than 60,000 since December. The mysterious virus that emerged in December 2019 in Wuhan spread globally within months, killing at least 17 million people. But residents in Wuhan say they no longer fear the virus and are looking to the future for a fresh start. Shoaib Hassan has the story.
This was once COVID-19's ground zero. But now, after a difficult 3 years, life is back to normal for the citizens of Wuhan.
I think everybody probably knows about the anniversary. It's the first time we Chinese have come across such an important event over such a long period. Online people are talking about it a lot. I've seen a lot of people on Weibo discussing the 3-year anniversary. Now that we've opened up, everyone is quite happy.
While the exact date of the first case is still disputed, but generally accepted to be in December 2019, the first reported COVID-19 deaths came in January 2020. Chinese authorities were quick to respond.
At the beginning, I was not that scared, but slowly after the lockdown, we started worrying a bit. But the policies meant we didn't really get infected during the more than 1 month of lockdown, so it was pretty good.
The lockdown was soon implemented across China. Experts say they did save lives, but were too late to stop the global spread of the virus. At least 3 million people died from the virus in 2020, forcing governments to restrict the movement and activity of citizens.
It's not been easy doing anything these few years. Everyone has been facing different levels of hardship in work and life. Of course it's been hard. If I said it wasn't, that wouldn't be true. It's been a hard time.
Things have improved with the emergence of effective vaccines, with China and Wuhan also making the transition back to normal life.
I think everyone's gone back to how it was 3 years ago. People are going about their lives, coming together with family and friends, going out to play and travel and being happy. A lot of things have come back now. A lot of our worries and depression have all slowly been resolved.
Citizens in Wuhan say they remain careful of health protocols as the pandemic is still not officially over. But they are also eager to march forward and let the strain of the last 3 years slip away. Shoaib Hassan, TRT World.
Well, Dr. Bharat Pankania joins us now live from Bath in the UK. He's a senior clinical lecturer at the University of Exeter Medical School. Fantastic to have you on today, Doctor. We're discussing Wuhan 3 years on, and of course you've been with us throughout these 3 years here at TRT World as we all navigated this terrible pandemic. What have we learnt from the first COVID lockdown in Wuhan?
So we've learnt a lot, Maria. We learnt that if you have test, trace and contain and you do it really well, it is possible to slow down and even stop the spread of this infection. China did extremely well with its test, trace, contain policy. We also learned that we can invent really good, effective vaccines. And unfortunately, where China has gone wrong is it continued with its lockdown, but didn't immunize the right age groups in the right sequence.
That's very important. It didn't immunize the right age groups in the right sequence. So talk to us a bit more about where it went wrong. Is that the elderly that it didn't immunize? And also we know they were using their own homemade vaccines. Could they have used what the rest of the world did to avoid maybe what we're seeing right now?
So yes, you're absolutely on the ball, which is they targeted their younger working age group to be immunized first, whereas we know the science was known that the infection harms and causes more severe disease in the elderly and vulnerable groups. So the sequence should have been elderly, vulnerable, healthcare workers first, followed by younger age group, followed by people who are in working age group, and so on. And furthermore, with respect to the vaccines, we knew pretty earlier on that the mRNA vaccines, this is the AstraZeneca, Oxford, Moderna, and Pfizer vaccines, perform better than the Sinopharm vaccines used by China. So the vaccines used by China are the traditional vaccines. They do work, of course they work, but they don't work as well as the mRNA ones invented in the West, and China could have done better to use those.
Why not? Why didn't they apply for them? Why didn't they do that and avoid all the deaths we're seeing now and that we've seen?
So it is a mistake, and this is where, unfortunately, China went wrong, which is, national pride. We made the vaccines. We want to use our vaccines, and these vaccines have been used elsewhere too, no doubt. The issue is that you need to continually use them and boost, like we have done in the West. And in China, whilst they have used it, they haven't extensively boosted their vulnerable population. And they kept them locked down. So that population hasn't been exposed to infections. So now it's like a new pandemic, new arrival of virus to many people in China.
Now it's like a new pandemic. That sounds very scary. And we're hearing only, Dr. Bharat, about the deaths being reported from hospitals. What concerns do you have about the data in general that's coming out of China, and also possibly what's happening in the rural areas?
So I feel that the Chinese Lunar Year has just taken place, and there will be a surge in infections nationwide because there's a lot of movement of people. And if you look at proxy measures for cases, i.e. the shortage of supplies for medication, simple things like paracetamol, aspirins, etc. There is a worldwide shortage because there's a lot being used in China because a lot of people are ill. And my other concerns are that this doesn't only apply to China. Neighboring countries like India have also not had that extensive booster program in the vulnerable age groups. So the next few months is be very careful and watchful in other countries where they have also used the Sinopharm platform of vaccines.
And is the West or the countries that produce the mRNA vaccines at a stage where they could supply what China needs right now, and also India?
Oh, absolutely, absolutely. And this is political decisions. And I wish politics wouldn't interfere with science. The science clearly tells us that the mRNA vaccines perform better. So bite the bullet and use the best for your population. Get this pandemic over sooner. Also, you really need to talk to your population and encourage them to be boosted rather than to say, it's all over, we're happy now.
Absolutely. Dr. Bharat Pankhania, always a pleasure to speak to you. It is fantastic. We always learn so much with your analysis and your expertise. Thank you again.